Video here is about a hammer toe. And in a hammer toe, the toe, instead of sitting nice and straight as is pictured here or here, it starts to buckle back. So here's the nail here, this is the metatarsal bone behind it, and in a bologna slice through this way, this is what's shown here, that this is the second metatarsal pushing down, and you can get a heavy callus under here. I've actually had patients where the bone is actually sitting up here, and so you have to try to obviously get it fixed before it gets to that point, but you know, people will not come in as soon as they should. So what happens here is usually the metatarsal behind it will need to be shortened. If not, then traditionally you'd take the knuckle out here. What I've been doing as part of the minimal incision, more of the cosmetic approaches, and to try to preserve the joints here and here, is to make an osteotomy here or cut the bone here and here, and that allows the toe to then straighten out to go, you know, in a line. And then that can have you can tape it, or you can put a pin in it to help hold it in place depending on how stable it is. So that's kind of a short discussion on a hammer toe, but essentially you have to understand that the hammer toe is there because of the joint is out of balance, and you need a doctor exam to try to look at, is it because of a tight Achilles tendon, is it because of a neurological problem where the tendons on top are overpowering the tendons on the bottom, and so forth. So that's a whole separate kind of conversation, but that's a short discussion about some of the fixes.